You know that engaging your core is really important if you're trying to recover from a back injury. Now you probably see there's a little band on the door here. We're going to go through some live examples in this video. But really, when it comes down to core exercises, there are some really important principles that you really need to adhere to if you're going to be successful. They can make some exercises completely ineffective if you do them wrong. And in other instances, if you make some of these mistakes, you take a perfectly good, helpful exercise and make it something that is detrimental to your overall progress and the status of your lower back. Hopefully you're going to find this video really helpful. Let's get straight into it. So I mentioned in this video, we're going to be doing a live example. We're going to be doing the ab rotations. Now these are an upright exercise. They are maybe a little bit more advanced than some of the floor-based exercises you could do, but they're not so advanced. We're going to be in a nice, neutral, good posture when we're doing these exercises, and we're really thinking about what's happening in this zone here for this particular video. We'll demonstrate now with the band what these look like and how they should be done. So when it comes to the ab rotation, we have to remember that above the abs, above the rib cage, there's not really any rotation, any torsion. We want our eyes looking straight at where our hands are. We want to be stood slightly back of where the anchor point is. That's very, very important. And we don't want our arms coming across because this isn't doing the core. We want to keep everything still and we rotate about the core. A nice strong engagement, nice good posture, and we come across and back. And we come across and back. And we are pulling with the core muscles here. We're not pulling with the arms. Some of you guys are going to get your arms getting tired when you're doing this sort of exercise, and that creates issues. But how do we what tips can we take to make this actually work? Because we can do this and I feel absolutely nothing. It is not doing anything at all. I'm just going to make myself completely dizzy. But when we do it properly, we can really engage and get a nice squeeze. And that is what we're going to help you with in this particular video. The tips are going to be applicable to not just this exercise, but any core exercise that you're doing. And really, if you're doing a proper rehabilitation program for your lower back pain, these things should be applied to other muscle groups that you're working in other exercises to complement that core. So the first thing we want to consider is an error. And this is one of those errors that if you do it wrong, then it's going to actually make a good exercise a bad exercise. And that is the use of Valsalva. When it comes to engaging the core, you'll see bodybuilders, you'll see powerlifters, maybe not so much the bodybuilders, but certainly the powerlifters and other examples where people will use Valsalva. And that is essentially a straining to engage the core muscles. It's engaging all of this whilst breathing out. And you can see my stomach hasn't moved. It would just increase intra-abdominal pressure. And now we're about to do an exercise. This is a really big mistake if you've got lower back pain. Now, there is certain credibility in using that as a strategy, but those athletes that are employing these sorts of strategies, maybe to do a personal best on a deadlift or a personal best on a squat, is not something that we want to take and apply to our lower back rehab when we've got an L4-5 disc bulge. So we're going to get some more examples pertaining to this core engagement and the different nuances in a moment, which will really come back and tie this in. But if we look, as we go and do this Valsalva, nothing really changes. Nothing's really changing in this region. I'm just tensing my core muscles by creating pressure inside my abdomen, rather than adjusting the position of those core muscles and engaging them correctly for the purpose of what we're trying to achieve, which is a core engagement. We're just pressing everything out and using the core muscles to hold on, rather than using the core muscles to compress in and provide stability. And that is a big difference. If we have any sort of weaknesses, historical hernias, all those other sorts of things, using this strategy can create serious problems. And when I say hernias in that example, I'm on about hernias through the abdominal wall and inguinal hernias. They can be really problematic if we're using this as our primary method of engaging through straining. And it's something that people always do. The real cue here is in the breath. We're doing the exercise. Let's pretend it's the core example that we've just done a moment ago. And we go, like that. It's just the wrong way to do things. You're going to make yourself really bad. So we've had that example. The next example is kind of an insignificant example in many ways. It's the old breathing in. Now we're going to actually see something change here. We're going to go, you see my stomach come in? My stomach came in there. Now people will say, oh, well, I'm breathing in. What muscles do breathing in, and what should happen when we breathe in? When we do that example there, we're actually using our upper ribs, we're using our scalene muscles to elevate the ribs, to lift them up as we breathe. If we're breathing correctly, we should actually have this happening. Watch my stomach closely. This is one of the biggest challenges that a lot of people face when they first learn to re-engage their core. Just from a simple point lying on the floor, learning to engage those core muscles is something that people really struggle with because they don't breathe properly. So when we say engage your core, immediately And that's nothing to do with the core muscles. So if that's the set point that we start off with, you see why we chose this one rather than an exercise on the floor, because it's very easy to grab the band. If we just go and then twist, I've got no core engagement. And to be honest, this feels a bit nasty on my spine doing this. I know I'm doing it quickly, but you get the point. We're not actually engaging those core muscles. That is a problem. What we should do, and you might have, the astute man, you might have seen this when I did the breathing example, the correct breathing example, is as we breathe in, tummy comes out, and as we breathe out, we use those core muscles to fully expire. The core muscles play a role in forced expiration. That is that when our diaphragm has finished its movement, its natural movement, the diaphragm runs all the way around here and is the primary muscle that is responsible for our breathing. But when we've emptied the main range of motion through our diaphragm and emptied most of our lungs, we can use our core muscles to squeeze the bottle even more to get what's called forced expiration, expel even more air out of this cavity here, and that is creating this compression, this unidirectional or omnidirectional compression through the midsection to really hold stability to that part by using your core muscles. So how do you know if you're doing this right? Well, there's a really good test that you can do to help you understand if you have the ability to control these core muscles a little more autonomously. And don't worry, it takes practice. You didn't learn to walk the first time your parents stood you up on your feet or you managed to clamber up to an upright position and you just walked smoothly. It took time, it took effort, it took perseverance, and it took a few falls along the way to learn how to walk. We didn't just say the first time you fell over. Walking's not for you. You can't do it without falling over, so let's just keep you on the floor on all fours. No. We learn, we practice, we're willing to make some mistakes. And learning this particular strategy, it's very easy. Just learning the core engagement itself, there's very little risk. There's very little chance of things going wrong, even if we do the engagement incorrectly, because we're just not doing it properly. So it's what I call the belly drill. And what that means is if we do a full out breath, okay, so I'm not breathing here, we can control the core muscles and let the tummy come in and come out by engaging and relaxing our core muscles. Exactly the same as just doing that. Just simply doing that. I'm using my bicep to bring up and I'm relaxing my bicep to let it go back down. Bicep to move up and relaxing again to let the arm drop back down. With the core here, we're just letting it come out and in, out and in. We can hold our breath and then we can let it come out and in. And it doesn't matter what I'm doing with my breath here. My tummy is just going in and out, and we can hold it and we can let it go. We can hold it and we can let it go. Why is this so important? This is so important because if we're about to pick up a box, we can engage and then pick the box up. If we're going to do an exercise, we can engage because I don't need to do a routine before I do that. I don't need to think about it so much. I just learn to engage, draw those stomach muscles in, hold it. Notice I didn't round over when I did that. My spine stayed neutral and I just draw the stomach muscles in. The rib cage pops out a little bit because that's the prime position because we're engaging all the way around here. We're engaged and then we go through our exercise and instantly these muscles are already slightly engaged, and then when we do that rotation, they really, really tighten up on the side that's making the primary pull. So as you can tell, this is a much more active video. It's something that's really, really important and so many people get lost in it. So that's why we're putting a little more energy into this particular video. But the next one is probably going to get me sweating a little bit more as well. And that comes with doing the shadow. Now to stop the video right now, we'll just think about this right now as we're talking about it. If you get your bicep and you squeeze it really tight, you can make it cramp up. If you get your pecs and you squeeze really tight, you can make them cramp up. Any of these muscles in your body, if you go up on your toes really, really high, you can make those muscles cramp up. We should be able to, because people sometimes say, oh, I don't feel it. I'm doing my ab rotations and I just don't feel anything. Nothing's working. I need more strength. Let's put on 4 or 5 more bands so I can actually feel it. I'm just too strong. And that is a real mistake. It's more that you're not engaging properly. And this is really important. We should be able to, with no weight here, get those muscles with a strong core engagement to really start to cramp up as we're doing this rotation with absolutely no resistance whatsoever. This is sort of shadowing the rep. Especially for an exercise like this, we can do it very easily. We can have resistance or we can have no resistance. But quite often, a lack of proper core engagement means we don't feel it. But we should be able to feel it even when we're shadowing the exercise if we've got the muscles engaged correctly. So if you're finding an exercise, one of these core exercises, you're not getting it right, really, really hone in on that core engagement. Engage it tight and then try again. And you should find there's a significant difference. You might not get it the first time, but if we can't get a degree of cramping from engaging these muscles and just shadowing exercise, there's probably something wrong there with regards to your ability to engage. And don't be disheartened by that. Be elated by that, because it highlights an area that you have for improvement. When it comes to lower back pain, people often get disheartened. They say, oh, I can't do that exercise. Well, I've had back pain for 5 years, for 3 months, for 2 months, 2 weeks, whatever, and I can't even do that exercise. This is awful. It's not awful, because there's something that's very, very clear, very, very simple, very, very easy that you can't even do, but you can work on it. You can make improvement. You can steadily break that exercise down and build it back up to the point where you can do it, which implies that you fixed a weakness that was there before that was causing you all sorts of trouble. So don't get disheartened if you can't do these things. Practice, 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 and you get better at them. Rome wasn't built in a day, and with the example of the walking earlier, when you were a little one, learning to walk, you didn't do it first time. You fell over a couple of times. It's okay. View it as a positive. It's something that you've identified you can work on, and you have the ability to do that too. So hopefully, if you've watched the video this far, you found it helpful. You found, hopefully, things you can work on, things that you can think about next time you're doing your rehab exercises. Remember, if you're watching these things on YouTube, these videos on YouTube, and you're seeing lots of different videos talking about different things, maybe even talking about things like Valsalva that we've mentioned in this video, the straining, there are going to be different bits of advice for people in different stages of audience. People that are doing videos for athletes, people that are doing videos for building your abs, people that are doing videos for cosmetic reasons or aesthetic reasons. But these videos are targeting giving you the right advice for someone with back pain, someone recovering from a back pain injury. And the advice and the practices that we do at that stage can be different from other advice that we do in other areas of life, other areas of sports performance as well. So please, I know it's sometimes easy to get confused with the different information in different places. Just follow what's said here, recognize that it is for you if you've got back pain, and that some of those other things are maybe for people in a different set of circumstances. If you don't have any bands and you want to get some bands, there'll be a link above here where you can get some. They work so very well and they're so versatile that you can do a huge array of exercises from home, especially if you can't get out of the house or it's not convenient to get home from work and then shoot off to the gym. They allow you to still take care of your body from the comfort of your own home. They're really, really helpful. If you have found this video good, or maybe you know someone else who's working on strengthening up their back, then consider sharing this video with them. If you've watched it this far, please do consider giving us a thumbs up. It helps support the channel and helps us know what sort of videos you guys like, what sort of videos you find helpful, so we can really gear our content to make it more useful and resonate better and provide you with the advice and guidance that you need to get your back in shape for the long term. Thanks for watching, and we'll see you in another video.